What is meconium aspiration syndrome? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law in the state of Maryland, and I would like to quickly talk with you today about that question. What is meconium aspiration syndrome? Now, meconium aspiration syndrome, it starts with that first word, meconium, and essentially what meconium is it is your baby's stool, okay? It's the baby's stool. And so meconium coupled with certain other factors can sometimes suggest that your baby may be in what we call fetal distress during labor and delivery. And so, I've done videos that talked about the electronic fetal heart monitor, and they get into fetal distress. So I'm not going to go too deep into that today. And for this video, just suffice it to say that when there is evidence of fetal distress, doctors have to make sure that they're doing everything that they can to help alleviate that fetal distress. And if there are continued problems, then they may have to move to an emergency C-section. And the reason being is if they don't move to an emergency C-section, then the baby can suffer a serious injury. And in some instances, this can be a brain injury. But going back to that question of meconium aspiration syndrome, what this essentially means is that when the baby is coming out and everything is going through, the baby can sometimes swallow that meconium, or they can ingest that meconium. And if they do that, this can be problematic for the child because the substance can go ahead and go down. If it gets below the cords, then it can get into the lung area. And then that can have devastating effects on a baby in certain instances. So you could have issues with infection. You could have breathing related problems because of meconium aspiration syndrome. So when a baby is dealing with MAS, doctors have to work to clear the airways, get them cleared as soon as possible so the baby can go ahead and begin to breathe, get the lungs working the correct way. Now, in some cases with MAS, if the substance gets down really far, and if it's a lot of it, it can affect the baby's ability to breathe, the baby's ability to get oxygen. And in some of those cases, if there is a problem with the baby getting oxygen, it can lead to a brain injury. So this video today was just really quick, just to kind of let you know what is meconium aspiration syndrome, why it can be very problematic, and why doctors have to make sure that they work quick to get those airways cleared and to help the baby out when the baby is dealing with MAS. So why have you taken the time, or why have I taken the time today to talk with you about this? Because more than likely, if you're watching this video today, your baby may have been dealing with MAS and you may have questions about it. Like I said, in many cases, doctors can help, alleviate the issues surrounding MAS. And it may not cause any long-term problems for your child. But in other cases, that may not be the case. And in worst case scenario, could be possibly death if there's oxygen problems, or even a brain injury in some instances. So if you have more questions, or you would like to speak with me further about your baby's MAS, and you would like to get some more information on it, remember, this is what I do. You can pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, you can reach me toll free at 1-833-4BABY-HELP. You can also reach me by email at medicalinjury@bostonlawllc.com. I answer birth, trauma, and medical malpractice questions just like yours all the time, and I'll be happy to take some time to listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law at Boston Law Group LLC, and we will see you next time. Take care and enjoy the rest of your day.